Hello, I'm Cindy Syrian with Community Medical Centers. Thank you for joining us for this edition of Community Med Watch. We begin with a story that has the potential to affect us all. A little more than 1 in every 10 people will suffer from painful gallstones. So if not you, likely a friend or relative will feel the pain. Tonight, one woman tells us how a pair of excruciating attacks helped her decide that surgery was the best option for her.
Roll it, pat it, mark it with the teeth, put it in the oven for Kristen and me.
Snack time is also playtime for Stephanie Mattis and her daughter Tristan. But not long ago, severe pain in her abdomen area left Stephanie afraid something might happen while she was alone with her daughter.
I told him it was probably the most excruciating pain I've ever been in, probably worse than giving childbirth. I would go through childbirth 10 more times and have one more attack.
You touch your nose?
Stephanie now knows that women are more likely to develop gallstones than men. Even though her mother and sister both had the problem, she was surprised by the attacks.
I was shocked. I was like, you got to be kidding.
She says her situation has made her aware of the warning signs, and she'll be sure to share those with Tristan when she gets older. Most people with gallstones don't have symptoms. However, for those who do, they can vary from patient to patient. They can include steady, severe pain in the upper abdomen that increases rapidly, pain in the back between the shoulder blades and/or under the right shoulder, nausea or vomiting, colic, and you should seek immediate medical attention if you experience yellowish color of the skin or whites of the eyes or a fever. Eating fatty, spicy foods can trigger gallstone pain, and the time between attacks can be unpredictable, ranging from days to months or even years. For most patients, that pain can be relieved with a cholecystectomy, removal of the gallbladder. The majority of the cases are now done laparoscopically.
This is the gallbladder. It's kind of pear-shaped underneath the edge of the liver.
Minimally invasive surgery has made a big impact in all aspects of general surgery, and gallbladder is probably one of the most important ones as far as patient satisfaction, patients getting back to work earlier.
Your liver makes most of the digestive juices, and the gallbladder stores the digestive juices and then concentrates them. So it doesn't make any of the digestive juices, it just stores them.
In other words, the gallbladder is not an essential organ, and removing it is the only way to make sure you don't have another attack. With minimally invasive surgery, the surgeon works with a thin tube that carries a video camera and 2 instruments that act like tiny hands to help him remove the gallbladder. All of this requires only 4 tiny incisions, compared to one 5 to 8 inch long cut in the abdomen with traditional surgery.
And it's going to come. The surgery is an outpatient procedure. It usually lasts about a half hour to an hour. Part of that's the setup time, part of that's the surgery time. Usually the patients that stay overnight are the ones that we have to convert to the old-fashioned open incision. And so, yeah, very, very rare does anybody stay overnight.
I had 4 very small, less than an inch incisions that are made. My recovery was very fast. I was only in pain maybe 2 days, which I had to take my pain medication for.
Stephanie had her surgery at the Fresno Heart and Surgical Hospital.
Basically there, when I needed them, my pain was under control the entire time. So yeah, I would definitely recommend having surgery there.
Even though she has had her gallbladder removed, Stephanie, who has always tried to eat healthy, is trying to set a good example for her little girl. She wants to give Tristan every advantage. She hopes by watching her good eating habits, she'll save her daughter the pain she has had to go through.
I think the most important thing you can do for gallbladder disease or gallstones, but life in general, is eat a well-balanced, well-rounded diet that's low in fat, and then do your exercise.
I'm very happy of the choice that I made.
Good girl. Good job, Tristan.
Then patients can enjoy moments like this worry-free. It's certainly important to feel free to enjoy life and the special times that come with it. Here are some of the characteristics putting folks at risk for developing gallstones. It's more common in women aged 20 and above. However, as women get older, their risk factor comes more in line with that of men. Obesity puts people at a higher risk for gallstone disease. People that are simply moderately overweight can have twice the risk as a patient at a healthier weight. And rapid weight loss due to a low-calorie diet or weight loss from a surgery can also be a contributing factor. And finally, ethnicity can also play a role. Hispanics and Northern Europeans have a higher risk than people of Asian or African descent. For more information about this story, visit our website at medwatchtoday.com.